ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਸਵਾਗਤ ਹੈ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਅੱਜ ਦੀ ਇਸ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਦੇ ਵਿੱਚ ਟੋਰਾਂਟੋ ਤੋਂ ਮੈਂ ਹਾਂ ਜਸਲੀਨ ਕੌਰ ਸ਼ੁਰੂਆਤ ਕਰਦੇ ਹਾਂ ਅੱਜ ਦੇ ਐਪੀਸੋਡ ਦੀ ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਵੱਲੋਂ ਸੂਬੇ ਭਰ ਦੇ ਹੈਲਥ ਕੇਅਰ ਕ੍ਰਾਈਸਿਸ ਦੇ ਨਾਲ ਨਜਿੱਠਣ ਲਈ ਕਈ ਪ੍ਰੋਸੀਜਰਸ ਪ੍ਰਾਈਵੇਟ ਹੈਲਥ ਕਲੀਨਿਕ ਦੇ ਵਿੱਚ ਕਰਨ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਸੀ। ਇਹਨਾਂ ਦੇ ਵਿੱਚ ਕੈਟਰੈਕਟ ਸਰਜਰੀਜ਼ ਅਤੇ ਸਿਟੀ ਸਕੈਨਸ, ਨੀ ਅਤੇ ਹਿਪ ਰਿਪਲੇਸਮੈਂਟਸ ਵੀ ਸ਼ਾਮਿਲ ਹਨ। ਇਸ ਦਾ ਮੁੱਖ ਮਕਸਦ ਹੈ ਹਸਪਤਾਲਾਂ ਦੇ ਵਿੱਚ ਸਰਜੀਕਲ ਬੈਕਲੌਗ ਨੂੰ ਖਤਮ ਕਰਨਾ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਦੱਸ ਦਈਏ ਕਿ ਬੀਤੇ ਕਈ ਮਹੀਨਿਆਂ ਤੋਂ ਵੱਖ-ਵੱਖ ਪ੍ਰੋਵਿੰਸਸ ਦੇ ਪ੍ਰੀਮੀਅਰਸ ਵੱਲੋਂ ਫੈਡਰਲ ਸਰਕਾਰ ਤੋਂ ਵੀ ਹੈਲਥ ਕੇਅਰ ਟ੍ਰਾਂਸਫਰਸ ਵਧਾਉਣ ਦੀ ਮੰਗ ਕੀਤੀ ਜਾ ਰਹੀ ਸੀ, ਜਿਸ ਲਈ ਪ੍ਰੀਮੀਅਰਸ ਨੇ ਕੁਝ ਦਿਨ ਪਹਿਲਾਂ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਦੇ ਨਾਲ ਆਟਵਾ ਦੇ ਵਿੱਚ ਮੁਲਾਕਾਤ ਕੀਤੀ। ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਵੱਲੋਂ ਸੂਬੇ ਦੇ ਹੈਲਥ ਕੇਅਰ ਸਿਸਟਮ ਦੇ ਵਿੱਚ ਸੁਧਾਰ ਲਿਆਉਣ ਲਈ ਕੀਤੇ ਜਾ ਰਹੇ ਕੰਮਾਂ ਸੰਬੰਧੀ ਅਸੀਂ ਵਿਸਥਾਰ ਦੇ ਵਿੱਚ ਗੱਲਬਾਤ ਕੀਤੀ ਓਨਟਾਰੀਓ ਦੀ ਸਿਹਤ ਮੰਤਰੀ ਦੀ ਪਾਰਲੀਮੈਂਟਰੀ ਅਸਿਸਟੈਂਟ ਅਤੇ ਮੈਂਬਰ ਆਫ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਪਾਰਲੀਮੈਂਟ ਡੌਨ ਗੈਲੇਗਰ ਮਰਫੀ ਦੇ ਨਾਲ। ਹੈਲੋ ਮਿਸ ਮਰਫੀ, ਥੈਂਕ ਯੂ ਸੋ ਮਚ ਫॉर ਜੁਆਇਨਿੰਗ ਪੀਟੀਸੀ ਪੰਜਾਬੀ।
Excellent. Thank you so much for having me, Jasleen.
Pleasure to have you on our show as well. Ms. Murphy, as we heard that the government announced that some of the procedures can now be performed at private clinics with OHIP coverage. So how quickly do you think we can see the impact on the backlogs in Ontario?
Well, I'd like to think we're going to see it soon. First off, again, thank you for having me on your show. And this plan that we have just presented is all about putting Ontarians back in charge of their health through the release of Your Health, a plan for connected and convenient care. So just to give you an example of what's been happening since the announcement regarding our Pillar 1, the right care in the right place, minor ailments, as you're aware, I believe we announced this at the end of December, and nearly 40,000 assessments have been completed and over 31,000 prescriptions have been issued since allowing pharmacists to prescribe medication for 13 common ailments. That started as of January 1. So I think that is a phenomenal uptake. So back to your question about community surgical and diagnostic centers. With that type of uptake on minor ailments with pharmacists, I'm sure that we are going to have a very fast uptake with what we're doing with the community surgical and diagnostic centers. So you are aware, we've made an investment of $18 million for existing centers to do over 49,000 hours of MRI and CT scans. What that means is that people are going to be able to get a diagnosis sooner so we can have better outcomes.
All right, as we know, the backlogs are major concern right now. So if the backlogs are resolved by the end of 2023, will government plan on keeping some of the public surgeries back in the public sphere?
So what our plan is because we do believe that a lot of these surgeries in the backlog will be performed by the end of March 2023. So what our plan is number one is that 4,800 cataract surgeries and 900 other ophthalmic surgeries and thousands of other procedures will be completed. Now, this is just part of our plan because as you're aware, we have 50 new hospital build projects underway in some form or another. So the expansion to the community surgical and diagnostic centers, that's only one piece of the puzzle so that we can ensure that Ontarians are receiving the right care they need close to home in the most convenient manner.
Ms. Murphy, as we know that after the announcement came, the upselling concerns were also raised. So how the province is going to monitor and prevent some of these private clinics from upselling so that they cannot make a profit, because most of these private clinics are for profit?
Mm-hmm. Well, thank you for the question. And as far as upselling is concerned, today the process is that the OHIP covers a certain surgery to ensure that a patient receives what they need for their specific care. Now, today, even in hospital settings, a patient may be offered a different lens or something like that, but the physician does advise of any additional cost outside of OHIP coverage. So what our government has said is that we will ensure that if there is a situation where a patient was not aware of an additional cost associated, we will investigate accordingly, and then all charges to that patient would then be returned and reimbursed to that patient.
All right. Another major concern is about the wait times at the children's hospital as well. So what are the plans to address the surgical backlogs in children's hospitals, which stands around 12,000 children?
Thank you. So you probably heard one of the things that we are doing as well is that for adult patients who are waiting for a bed, adult patients in hospitals, we are also moving pediatric into hospital beds so that we can clear more of those surgeries. So that's part of the process that we are doing. And in fact, with pediatrics, nearly 16 million to permanently increase the number of critical care beds at CHEO as well as McMaster Children's Hospital.
What do you think, what more needs to be done to speed up the better national healthcare reporting system in Ontario?
Well, thank you for that question. I think everything we've been doing, Jasleen, because this is why there's three pillars between our plan to, number one, the right care in the right place with the various things that we are doing, including increasing interprofessional, primary care teams, doing the faster access to care, as well as hiring more healthcare workers. All of these things are coming together to aid us in getting through our backlogs. Any other thing that could help is obviously increasing the Canada Health transfer, because right now you're probably aware that it's sitting at an all-time low of 22%. And next week, the provinces and the federal government will be talking about the health transfer. And we are hoping, and we're very hopeful, that will be increased to the 35%. If it was increased to the 35%, that would literally inject $10 billion more into Ontario's healthcare system, which we could do so much with. Our government has actually put in, since 2018, an additional $14 billion into our healthcare system. So if given our entire plan, the other thing that would help is obviously that health transfer plan being increased as well. Thank you.
As you mentioned about hiring more staff, we know that staffing is a major concern in Ontario these days. And can you tell us how this new plan will not end up pulling staff out of already short-staffed hospitals?
Yes, thank you for the question. And as you're probably aware, we've announced several plans as far as health human resources is concerned. And in fact, last year we had a record year of over 12,000 new nurses being registered, half of which were international nurses. And we have another 30,000 nurses studying at an Ontario college or university. Now, as far as the international nurses are concerned, we are working with CNO to break down barriers for up to 5,000 international educated nurses so they can register and practice in Ontario faster. So part of our plans is to increase, obviously, our healthcare workers in our province, and that includes Ontario being the very first province in all of Canada to allow healthcare workers registered in other provinces and territories to immediately start caring here in our province.
All right, Ms. Murphy, it was really a pleasure talking to you. Thank you so much for joining PTC Punjabi and for sharing your information with us and with our viewers. Thank you once again.
Thank you, Jasleen. Have a great day.
ਸੋ ਫਿਲਹਾਲ ਸਮਾਂ ਹੋ ਗਿਆ ਇੱਕ ਛੋਟੀ ਜਿਹੀ ਬ੍ਰੇਕ ਦਾ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਵੀ ਸਾਡੀ ਇਹ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਇਸੇ ਤਰ੍ਹਾਂ ਜਾਰੀ ਰਹੇਗੀ। ਜਲਦ ਹਾਜ਼ਰ ਹੁੰਦੇ ਹਾਂ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਇੱਕ ਵਾਰੀ ਫਿਰ ਤੋਂ ਸਵਾਗਤ ਹੈ। ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਵੱਲੋਂ ਸੂਬੇ ਦੇ ਹੈਲਥ ਕੇਅਰ ਵਰਕਰਸ ਨੂੰ ਟ੍ਰੇਨ ਕਰਨ ਅਤੇ ਕਰੀਅਰ ਗਰੋਥ ਲਈ ਉਹਨਾਂ ਨੂੰ ਬਿਹਤਰ ਸੇਵਾਵਾਂ ਮੁਹੱਈਆ ਕਰਵਾਉਣ ਲਈ ਨਵੇਂ ਪ੍ਰੋਗਰਾਮ ਉਲੀਕੇ ਗਏ ਹਨ। ਇਸ ਸੰਬੰਧੀ ਵਿਸਥਾਰ ਦੇ ਵਿੱਚ ਗੱਲਬਾਤ ਲਈ ਸਾਡੇ ਨਾਲ ਲਾਈਨ ਤੇ ਹਾਜ਼ਰ ਹਨ ਓਨਟਾਰੀਓ ਦੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਮਿਨਿਸਟਰ Paul Calandra. Hello, Minister. Thank you so much for joining PTC Punjabi.
Hi, thank you. Thanks for having me.
Minister, as we know that recently you introduced 2 educational programs to expand the number of trained healthcare workers in long-term care and increase the opportunities for career advancement. So can you first please share the details about it?
Yeah, so two programs, as you're right. The Begin program, the Nursing Transformation Initiative. The second one, the Transformation Initiative, allows us to provide more online courses for internationally trained professionals who want to get into the nursing programs here in Ontario, who may need some courses just to upgrade or other courses to meet Ontario standards. They're very flexible, as I say, they're online, and something I'm quite excited about, as well as the Begin program, which allows people to start their journey into the healthcare sector in the province of Ontario. So 2 good initiatives aimed at getting people from all over the world into Ontario, helping us as we transition and transform Ontario health.
So what is the eligibility criteria for these 2 educational programs?
Well, look, if anybody who wants to come to Canada and wants to get into start their journey as a PSW, these programs are available for them. They're available for everybody. What we're finding on the other side of it, though, on the transformation initiative, that we've invited many people to Canada and to Ontario specifically, and in some instances there may be a course or some other type of training that is required for their credentials to be recognized. And we encourage everybody who's in that position to look at these courses. They're available 24 hours a day, 7 days a week. It allows those healthcare professionals who need their credentials, additional credentials to work in Ontario, flexibility to get those credentials basically on their timing and when they're available to do so. So, look, I'm very excited by both of them. We've always welcomed. And foreign trained professionals have been so important to healthcare in the province of Ontario. And we've always heard it's so difficult to get those credentials recognized. And finally, we're making a transition to not only get credentials recognized, but also get people who want to advance in their career path, allow them to do so.
Will there be any exam needed specifically for internationally trained nurses?
Yeah, so look, whatever courses that are required or upgrades that are required, they can do them online. There is examination requirements through the different colleges. But as I said, our problem is it's never been, frankly, if I could say this, there's never been the quality of the people that have been coming here and the education that they bring and their dedication to healthcare. There have been often, just small requirements that have been very difficult for the people who have come here to finish these courses. So by making them available 24/7 online, we bridge that gap. And we can get as many people trained or credentials recognized and new people into the field, right? So we need people, and these 2 initiatives allow us to start filling the gaps that we've had in healthcare, especially in the nursing on the nursing side.
All right, Minister, moving on to my next question. Recently, new standards were released for long-term care homes, and experts with the non-profit organization say that it will only do the job if all the long-term care homes adopt it. As the long-term care falls under the provincial jurisdiction, is Ontario government thinking about making these new standards mandatory?
Yeah, so I'm looking at what the federal standards. So the federal standards introduced last week, they're voluntary standards, not mandatory. And often with national standards, they're meant to be a floor and not a ceiling. So I'll take a look at them. If there's something that we can do to improve care in the province of Ontario, of course we'll take a look at it. But through the Fixing Long-Term Care Act, which we passed here in the province of Ontario, Ontario has right now, I would argue, the highest standards in the nation when it comes to long-term care. So, you know, I'm proud of those very high standards that we've put in place through the Fixing Long-Term Care Act. But again, if there's something to be learned, if there's something that we can do, then we'll do it. But I also think Ontario can provide guidance to other provinces when it comes to long-term care. Look, we've already transitioning to 4 hours of care. That's something that the national standards asked for. We're already doing that. It's already legislated in the province of Ontario. We're already building homes with infection prevention and control into it. We're building new long-term care homes all over the place. Brampton, Toronto, rural parts of the province. We're doing it in cultural homes for the first time in the province of Ontario as well. So there's a lot happening. But look, if there's something to be learned, then we'll take a look at it. But I also think Ontario can help other provinces achieve the standards that we've set here.
But when you say that you'll have a look on it, so what will be the timeline to take the decision on these voluntary standards?
Look, if I'm honest with you, I think we already meet or exceed every standard that the federal government has actually put in place already. It is. I suspect we're already there in Ontario. As I said, we're already there on the 4 hours of care. We're hiring 27,000 additional healthcare workers already to get us to the 4 hours of care. We're already building brand new homes and phasing out the old 3 and 4 ward bedroom homes. We're building 60,000 new and upgraded homes across beds across the province of Ontario. So we already meet or exceed, I think, virtually every one of the standards that the federal government, voluntary standards that the federal government has set in place. But as I said, doing a deep dive, and if there is something to be learned, then of course we'll take a look at it. But we're some of the highest standards in terms of licensing in Ontario, the highest standards in terms of inspection in Ontario, and the highest standards with respect to infection prevention and control, and moving to the 4 hours of care already.
All right, last question before I let you go. What more needs to be done to speed up a better national healthcare reporting system in Ontario?
Yeah, look, I think this is an important side. I know that's something that the ministers, the premiers will be looking at today with respect to how they share information back and forth so that we can meet certain standards and we can see where gaps exist. So this is something that Ontario has been working on, especially during the pandemic. But in order for this to truly be effective nationally, it is important that all of our partners nationwide participate in. I was happy to see Quebec's premier also suggest that Quebec will be part of this as well. And Ontario has already done a lot of work on that front. But you're absolutely right. Very, very important to transition, and very important to making sure that we have consistent levels of care across the country, but also right here in Ontario, that we have consistent levels of care between urban and rural parts of the province as well. And you can only do that if you gather the correct statistics and you know what is impacting healthcare and the provision of healthcare across the province.
All right, Minister Calandra, thank you so much for joining PTC Punjabi and for sharing your information with us and with our viewers. Have a nice day.
You too. Thank you. Bye-bye.
ਸੋ ਐਸੀ ਸਾਡੀ ਅੱਜ ਦੀ ਖਾਸ ਪੇਸ਼ਕਸ਼। ਜੇਕਰ ਤੁਹਾਡਾ ਕੋਈ ਸਵਾਲ ਹੈ ਜਾਂ ਫਿਰ ਆਪਣਾ ਕੋਈ ਵਿਚਾਰ ਤੁਸੀਂ ਸਾਡੇ ਨਾਲ ਜਾਂ ਸਾਡੇ ਦਰਸ਼ਕਾਂ ਦੇ ਨਾਲ ਸਾਂਝਾ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ ਤੇ ਸਾਨੂੰ ਜ਼ਰੂਰ ਲਿਖ ਕੇ ਭੇਜੋ feedback@ptcnetwork.com ਤੇ। ਮਿਲਾਂਗੇ ਅਗਲੇ ਹਫਤੇ। ਉਦੋਂ ਤੱਕ ਲਈ ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ ਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਖਬਰਾਂ ਲਈ ਬਣੇ ਰਹੋ PTC ਨਿਊਜ਼ ਦੇ ਨਾਲ।